I think I'm a typical man. I don't like to go to the doctor. There's never anything really wrong with me, and I had I had lost my ability to speak for about I don't know, about 15, 20 minutes one day, and of course it concerned me. But by that afternoon, I was feeling better and everything was all right, and I could speak again. And I mean, I could still speak, but I couldn't understand. Nobody could understand me. It didn't make any sense. And I noticed that my eyes were a little fuzzy, but they got better too. So I thought, well, it's just one of those things. I tried to think that. Um, I didn't go to the doctor. This was on Saturday afternoon, and I didn't go to the doctor. And on Monday morning, I felt just great. I felt like I was really all right. And she called a doctor friend of ours, Tom Cable. He June called him on the phone, and he got me on the phone, and he said, "What are you doing?" And I told him, and he said, "Stop what you're doing. You're going to Erlanger right now. I want you there now. I'm going to call the emergency room, tell them you're coming." And he wouldn't take no for an answer. So I went to the emergency room, and they admitted me, and that's when I met Dr. Tom Devlin, who decided that I did not have a tumor in my brain, but it was probably maybe a spike in my blood pressure, which it probably turned out to be. And they've since treated me for that, and that turned out to be a non-issue. But while I was there, he said, I want to make sure you don't have something in your body that's causing this issue. And so he gave me a full body scan, CAT scan, and that's when they found that I had tumors on both kidneys. One very large tumor, and the other kidney had rather small ones. But that's when I met Dr. Singh. Dr. Singh saved my life because it turned out they were very aggressive tumors. And on this side, on my right-hand side, he had to could not use laparoscopic surgery. He had to cut me open and actually go inside, and was able to extract the tumor. And on the left-hand side, he was able to use laparoscopic, and that was like a walk in a park. It was no pain, no nothing. So
we are so blessed to live in Chattanooga, where there is such a great hospital here with Erlanger. All the physicians, the staff, the administration, they're fantastic people. When Don was recovering from his surgery, Dr. Singh came into the waiting room and sat down with me and said he thought he got all of the tumor, but the one kidney was so riddled with little tumors that he considered removing it. And how did I feel? How would Don react to that? And I said, if you can save the kidney, I know he wouldn't want to go through dialysis. And he looked at me and he said, well, then we'll work on saving that kidney. And he did spend a lot of time in the surgery in order to remove all the little tumors. And in retrospect, of course, Don is so healthy and well, and vigorous, and we owe so much to the medical staff here at Erlanger for saving his life and giving him a good, healthy way of life after the surgery.
it's good to have good doctors around, and it helps you if they're your friends.